Welcome to the Parent Doctor podcast, where adults who are parents come to learn, lead with love, and grow. Hello, and welcome to episode 7 of the Parent Doctor podcast. I'm your host, Dr. Marissa Caudill, and today's episode is all about ADHD. Now, this is a very common diagnosis in kids. I know many parents have been asking me questions about, does my child have ADHD? Should I get them assessed for ADHD? Should I treat them for ADHD? So let's dive into that. But before we do, I would like to ask you to please rate this podcast. That helps me move up in the rankings and get heard by more parents. And I know that kids' mental health is a topic of interest to so many people, and there are not many child psychiatrists delivering on podcasts. So I want to make sure that we can get these messages out to as many people as possible. All right, so diving in, let's talk a little bit about what is ADHD. When did it first become diagnosed as a problem? That was in the 1960s. Not surprisingly, that was also around the time that stimulant medications started to be noticed as effective to treat people's inattentive symptoms. The prevalence of ADHD is a little bit hard to pin down. On the low side, it might be estimated at like 4 or 5%. On the high side, it's closer to 15%. We have data here in the US from various states, and it's interesting. The rates actually vary from down to like 2% to 11% by state. It really also depends on different factors like the age of a child, the gender of a child, the race of a child. So let's look at that a little bit because these are confounding factors when it comes to the diagnosis. Younger kids within a grade, so a child who has a birthday later in the year and is turning, say you have to be, 5 to enter kindergarten, but your child didn't turn 5 until the day before that cutoff. Well, they're more likely to be labeled by the teacher as a kid who's inattentive or struggling with focus than the other kids because they're a year younger. So one important thing we have to keep in mind is your child may not be exactly where their peers are in their class, but is that because they have ADHD or is it because they're a year younger than most of the kids in their class? Similarly, boys are much more likely to get diagnosed with ADHD than girls. The ratio is about 3 to 1, and that's because boys are generally just more physical, rambunctious, hyperactive maybe, than girls the same age. Similarly, kids of color are more likely to be diagnosed with ADHD, and I'm sure that that's because of inherent unconscious biases that people have to focus more on negative behaviors in certain people than in others. Now, we know all of that, so that's like the caveats of ADHD. Now, that said, as a psychiatrist, I can tell you ADHD is definitely a real and disabling diagnosis for some people. Is it a real and disabling diagnosis for 15% of people? No, certainly not that many. But it can really impair people's functioning. So I'm not saying that it's not real. I just think it's important that when we think about kids, especially, and giving them a diagnosis of ADHD, it's important to think about all the other things that could be contributing to a child's symptomatology in terms of inattention or difficulty sitting still, hyperactivity, all of those things. And then it's also important to think about what biases might be at play. Some possible coexisting disorders that can look like ADHD but might not be ADHD are things like learning differences or learning disabilities, antisocial behavior and oppositional behavior, anxiety disorders, trauma, depression, bipolar disorder, substance use, and sleep disorders. Let's talk a little bit about how do we assess whether a child has ADHD or not. If you're a parent listening to this podcast and you're thinking, maybe my kid does have some symptoms of ADHD, how would I even know where to start? I'm going to give you a link in the show description today to a website that has a free assessment tool that you can do on your own. You can even ask your kid's teacher to complete it as well. It's called the SNAP-4, and that's freely available. That is available online. So there's a form you can complete online, or you can just print out the PDF and complete it there. And it's not, again, this isn't meant to be a diagnosis for you or a substitute from an assessment from a pediatrician or a child psychiatrist. But I want you to have a place where you could go and at least do a screener on your own. Now, if you do go to a child psychiatrist or psychologist or pediatrician, they're probably going to give you one of the more assessment tools that you have to pay for. They're called the Conners, the Vanderbilt, the Brown, and the Child Behavior Checklist. So all of these are kind of questionnaires that get to the diagnostic criteria. So let's discuss what are those diagnostic criteria. In the DSM-5, it says ADHD is a persistent pattern of inattention and or hyperactivity-impulsivity that interferes with functioning or development as characterized by, and then it gives a list of inattentive symptoms, and a person has to have 6 out of 9 of those, or 5 or more if they're 17 and up. And then for hyperactive and impulsive symptoms, same, they have to have 6 out of 9 of those symptoms. So basically all of the questionnaires go through these diagnostic criteria. Now, the parents and a teacher or a coach have to give symptoms that meet criteria for ADHD in order for a doctor to give a diagnosis of ADHD. What I've seen as a clinician is that oftentimes one parent will rate a child very highly on these rating scales. The other parent will not rate a child as highly, and then the teacher might be kind of on the line. What that tells me is that there's one parent who's really struggling with this child, but within a classroom setting, the child is not standing out dramatically to the teacher, and the other parent either has a higher tolerance for the kid's behavior or a greater tolerance for the wide range of children's behavior, or just doesn't see it as a problem. So there's a lot of subjectivity in terms of making this diagnosis, and it can be hard to tease out. Even if a child meets all the criteria for ADHD, does that necessarily mean that you have to do anything? Now, you might be afraid as a parent to bring your child to the pediatrician because you don't want that label on your child. I want you to know, if you get that diagnosis, A, it's not permanent. B, it's up to you what to do with it from there. And C, you do not have to give your child prescription medications. Totally okay if you decide to go alternate routes. And I actually would recommend for most parents that you start with alternative routes, like being an advocate for your child, having a student success team meeting, SST meeting at school, requesting an IEP evaluation. That's an individualized educational plan that the schools can use to help support your child for success academically. And then we'll talk a little bit more about when I would recommend treating a child's ADHD. And there certainly are benefits to treating ADHD, but there are also some important drawbacks and cons to treating ADHD with medications that we'll need to talk about. Another great resource that I want you all to have is a YouTuber by the name of Jessica McCabe. She has a YouTube channel that started in 2018, which I was recommending years ago when I worked at Kaiser, and I'm happy to say she's really taken off. She even wrote a book called How to ADHD. And I don't know her background. I don't actually know if she has a neuroscience background, but her her YouTube channel rather, is really well grounded in neuroscience. And she's got some great tools there. And I know that young kids, especially like school age kids, love to watch YouTube. So if you have a kid who's struggling with ADHD, maybe you want to start there and start learning together some of the strategies and techniques that she talks about using. Basically, anything that increases dopamine signaling in the brain helps someone who struggles to stay focused and to pay attention. So anything that makes it novel, like racing against the clock, or having a special hat that you put on when you do your homework, or having a special place that you go, or a reward, anything like that is going to increase dopamine. And it's low dopamine in the dorsolateral prefrontal cortex that is thought to lead to the symptoms of ADHD. ADHD as a name is a poor name because people who have ADHD don't have an inability to focus. What they struggle with is a difficulty with appropriately shifting their focus for the circumstance. So when they need to stay focused on time, because maybe they're taking a timed exam and they need to be looking at the clock periodically to see how much time they have left, they can lose track of that and get stuck on one problem that they're really trying to solve and not leave enough time to finish the other 10 questions. On the flip side, people with ADHD can also hyper-focus and say your child might be really into some project they're doing or a video game they're playing. More often it's a screen-based thing that parents complain about. And the parents are yelling their name, calling their name, and they don't hear it at all. Because again, their brain is so focused on the thing that they're enjoying that they tune out the rest of the world. Now you can see how this would be problematic if that were your child, but you can also see that that has the potential to be an asset later in life. Because if you can hyper-focus on something, you can be really successful. There are many very successful creative adults who have ADHD and learn to use that to their advantage, and they fill in the gaps of the things that they might not be so good at with other people who are good at those things. So maybe they're not so good at keeping their calendar or answering all their emails, but if they can do other things and get people to help them with managing their calendar and doing their emails, they don't have to worry about all that. So if you have a child who has been diagnosed with ADHD, I don't want you to feel hopeless or feel like this is a horrible condition to have. it certainly can be a difficult thing, especially when kids are in school. Generally, our modern school system is pretty rigid, and it's hard for kids to find a way to succeed when the expectations are inflexible. And as a parent of a child with ADHD, it's on you to really work with the teachers to try to make them as flexible as they can be with your child, to build your child's responsibility and ability as they get older, and most importantly, to just remember that your child is going to grow and get better at the things that are challenging for them at this time, whether they have ADHD or not. But I think for a child who has ADHD, the trouble is that they often get labeled and they get feedback from teachers repeatedly about dropping the ball, missing an assignment, not turning something in on time. So they get a lot of negative attention, which tends to lead them to feel negatively about academic performance, even if they're a very intelligent child. And so that tends to, what I've seen, is lead to a kid developing kind of a comic relief, a class clown kind of personality to brush it off. Or as the child gets older, taking on this attitude of, well, I don't care about school and I don't care about that. Is it really true that they don't care? No, probably not. But it's an adaptation that they've created to be feeling better with the skill set that they have and with the performance that they tend to produce. Now, as parents, it's going to be on us to help our kids with educational therapy, executive functioning skills. None of this is really covered by medical insurance, and schools don't do a fabulous job at covering this for kids with ADHD. If you have an IEP at a big school, you might have some skills training that goes on, but more often than not, especially in smaller school districts and smaller school settings, there's just not a lot that schools can offer to 5% or less of their population. So that's going to be on you as a parent to help your child learn what works for you to keep track of things. And it's really important that you maintain kind of the coach or cheerleader attitude, recognizing and believing that your child can do it and will get there. They're going to fail along the way, and that's okay. That's not an indication that they failed because they're incapable. It's an indication that they failed because they're learning. And we have to support them as they try and fail, because that's how they learn, and that's how they're going to increase their skill sets. How often do kids outgrow their ADHD symptoms? Well, we do know that more than 50% of people who were treated for ADHD with medications in childhood decide that they no longer want those prescriptions or need those prescriptions in adulthood. So that's pretty good news, right? Again, brains develop. We've talked in other episodes and about the adolescent brain changes, pruning. All of that starts with the onset of puberty and ends at about age 25. So our brains are going to develop and keep getting better at all of these tasks that are a challenge. Hyperactivity especially tends to get better. People might subjectively feel restless, but it's very rare that a 25-year-old is going to be constantly, clicking a pen or tapping their foot or jumping around in a business meeting. Usually by the time our brains are mature, we're able to hold back on those impulses and navigate ways to have outlets that are more socially acceptable for the different settings we find ourselves in. Let's talk about the reasons to start treatment for ADHD. If untreated, ADHD can have a negative impact on a child's academic performance. More importantly, I think it can have a negative impact on a child's social interactions. If you have a child that's really impulsive, getting in people's personal space, interrupting their peers, at a certain point, their peer group is going to start to judge them for that and exclude them for that. And that can really negatively impact a child's self-esteem and their ability to fit in. Now, I do think younger kids tend to be more forgiving of this kind of behavior because it's more common that that's how kids behave. But as kids get older, usually around like 3rd, 4th, 5th grade, they start to get very judgmental of kids who aren't fitting in socially. So if you have a child who's really struggling with that impulsivity piece or the social skills part, again, not that medications are the only way to treat this. There's lots of social skills programs that can be helpful, but medications can be very helpful in this regard. We also know that as kids with ADHD grow up, because again, they have that impulsivity piece more commonly, they're more likely to take risks. We've talked before about in adolescence how all of our brains will overestimate rewards and underestimate risks. That's even more so true for kids with ADHD because again, the brakes that help them decide, should I do this or should I not, are really not as effective as those for a child who doesn't have ADHD. So one thing we do know from research studies is that treatment with medications seems to reduce a child's risk for developing a substance use problem in adolescence. Now, again, is this a very good reason to treat your child? Do most kids develop a substance use disorder in adolescence? Thankfully, no, but it's still something to consider, especially if you live in a place where there's a lot of substance use, especially if you know that your child is genetically at increased risk for a substance use disorder. Then maybe you do want to consider and have a conversation with them about the potential benefits of being on a prescription medication to reduce their impulsivity as they go through adolescence. Finally, ADHD medications can really be helpful for kids' academic performance. Often, kids with ADHD are underperforming what you would expect given their intelligence. And again, it's because that difficulty with appropriately shifting their attention really impairs their outcomes in academic settings, whether it be homework, turning in of the homework, tests and quizzes, all of that stuff. A very common problem I see with kids with ADHD is they might do their homework and then never turn it in, or they do it, but they leave it at home. And parents just want to pull out their hair. They get so frustrated with their kids. But again, it's just a symptom of the same condition. And it's treatable, but it also will get better with strategies and techniques like therapies and with medication. It doesn't just have to be medication. All right, all of that said about the benefits of medication, and there definitely are benefits, I need to say that as a clinician, there has not been one child that I've treated, and I've treated hundreds, if not thousands of kids for ADHD, but I really can't think of one kid under the age of, say, 14 who came to me after starting a stimulant medication that was objectively and subjectively helpful for them. Like they had a good outcome. Their teachers and parents said it was better. Their grades got better, all of that stuff. Even so, I've never had a kid come to me and say, "Thank you so much, Dr. Caudill, for that medication. I love how I feel on it. It's done great things for me." Never. I have had that happen with meds for anxiety and depression. When kids' anxiety goes away, they're like, "I feel so much better." Or when their depression gets better, "I feel so much better." Why is that? Well, in my training, I was told it's because young kids lack insight. They don't have insight into their ADHD symptomatology. They don't really see it as a problem. And that might be part of it. But I also think when it comes to treating, say, an anxiety disorder or depression, ideally, we help people feel more like themselves. In contrast, when it comes to treating ADHD, I think part of the treatment can make kids feel less like themselves. And this is true. Often kids who have hyperactive, impulsive ADHD are very gregarious, creative, loud, outgoing kids. And on medications, their personality does change. The medication really will make them quieter. It will make them have less to say because it puts the brakes on those impulses pretty severely and pretty effectively. In contrast, every time I've treated an older adolescent or an adult with ADHD medications, it might take some time to find the right combination of medications or the right medication for them as an individual without side effects. But once we find that right medication, they tell me, "This is amazing. This is how it is for people. They can just get stuff done." People will tell me it's similar to like having a vision problem and then putting on glasses for the first time and feeling like everything is clear finally. So ADHD medications really, really work. But because of the lack of positivity that I have seen from young kids, I kind of am a bit cautious about recommending stimulant medications in particular for young kids. I think, exploring and really maximizing the non-medication parts of treatment, like behavioral therapies, educational therapies, tutoring, all of that stuff, non-stimulant medications, supplements, before going to stimulants would be what I would do for my child if they had ADHD. Let's now shift and talk a little bit about medications. In the show notes description, I'm going to give you a link to a chart from a hospital. Every year they update this chart and it's got all of the ADHD medications listed there. Generally, there's two big categories. There are stimulant medications and non-stimulant medications that treat ADHD. Within the stimulant category, there's also two big categories. There's medications similar to Ritalin, and then there's medications that are similar to Adderall. Overall, stimulants are super, super effective. They are among the most effective medications in all of medicine. They work really, really well. That's the pros. The other pro is that you can take them as needed. When you take it, it kicks in and it works immediately. You don't have to take it for weeks to see the effect. And then if your child has a break from school or a weekend off or summer break and they don't need the medication, you can stop the medication. And when you resume it, it will work just as it did before. So there's no loss of efficacy with breaks and there's no need to be on the medication for a long time. So that's a big plus, right? If you're really in crisis or if your child's really in crisis, and ADHD symptoms have contributed to that because they're far behind in schoolwork, etc., then stimulant medications can be a very good option to explore. The cons are that stimulant medications are more prone to side effects than non-stimulant medications and more severe side effects. So especially for young kids, these medications cause appetite suppression that can be quite severe enough that as physicians, we have to get a baseline weight and check weight at every visit. They can also increase heart rate and blood pressure. They cause insomnia many times. They can cause anxiety. They can cause palpitation. And there's new research linking chronic use of stimulant medications in childhood with an increased risk for obesity in adolescence and adulthood. Now that's interesting, right? Because I just told you they suppress your appetite. So why would that lead to obesity? I don't know if we've really explored this fully or if scientists have figured it out, but my hypothesis would be that kids on stimulant medications often have those meds in their system throughout the day. So what I will tell parents who have their kids on stimulants is give them a good breakfast, then give them their pill. Then they probably aren't going to eat much at snack and lunchtime because their appetite will be suppressed. They're going to come home, and until the meds wear off, they're not going to be hungry. So when you serve them dinner, they still might not want to eat much. But at some point in the evening, their appetite's probably going to come back, and let them have a second dinner or give them whatever they want because we want to maintain their calories because they're growing. That's good for the growth part, but it's not so good for healthy signaling to the body of like what's a good sized meal, right? Because essentially these kids are like binging, I don't know if they're binging, but they're eating a lot of calories all at once and then going a long period of time without eating many calories during the day, which probably messes up the signals that our body's meant to get from our stomach about our food and how much we've eaten and whether we're full. And I suspect, I don't know, but I suspect that that may link to obesity in adolescence and adulthood. But as we all know, overweight and obesity is a problem that affects the majority of Americans now. So it's not just people on medications for ADHD. And obviously that's something that needs to be explored more. Aside from stimulants, the other big category of medications that we can consider, prescription medications that is, are non-stimulants. And these include things like Strattera, Clonidine, Intuniv, and Quellbri. The pros of these are that there generally are fewer side effects. Usually we can find a medication and a dose that doesn't cause any side effects once a person has acclimated to it. When it comes to initial side effects, the most common one would be probably sedation or nausea. But usually if you start at a really low dose and increase it slowly, that's usually manageable. Because these take weeks to work, and that's the big con, you have to take them all the time. It doesn't work to take a break on a school holiday. You really need to take the non-stimulant all the time because if you take a significant break, you have to resume it and give it weeks to work again. It's important in either case, whether your child is on stimulants or non-stimulants, that you have regular monitoring visits and follow up with your healthcare provider, whether that's a pediatrician, a child psychiatrist, or a nurse practitioner. The doctor or treating provider prescribing the medications needs to be able to check your child's blood pressure, their heart rate, their weight, and talk to them about any symptoms they might be having. Sometimes people get concerned that stimulant medications, because of their effect on heart rate, can be cardiotoxic or could lead to an increased risk of cardiac death. That has not proven to be the case. Generally, we don't need to get cardiology clearance before starting a child on a low-dose stimulant that's used in ADHD, unless there was some significant history in the child's history of heart problems like fainting with exercise or other, known heart pathology, or if there's a history within the family of anyone dying of a sudden cardiac event, especially at a young age, then that would warrant clearance by a cardiologist by getting an EKG prior to the child starting a stimulant medicine. There are also non-prescription options to treat ADHD. If you want to learn more about this, I recommend you go to my website, theparentdoctor.com, click the resources tab, and look for the videos that I have there about omega-3 fatty acids and micronutrient supplementation. When it comes to omega-3 fatty acids, you want to be looking for a supplement that has 600 milligrams per day or more of EPA. EPA and DHA are two of the main fish oils that help with brain health. These are kinked fatty acids, and our brains are very lipid rich. The neurons are coated in lipid membranes. These kinked fatty acids, when they are in those membranes, help the proteins in our membranes move around more freely and help the neurons to work better. There have been studies looking at omega-3 fatty acid levels in the blood of kids with ADHD showing lower levels than kids who don't have ADHD. So in some cases, maybe the presentation of ADHD symptomatology is linked to low levels of these special fatty acids that we can cure with supplementation. And there have actually been some research studies that suggest after 12 weeks of daily supplementation, many children will have a significant reduction in their symptoms. Given that, I would recommend that all parents who have kids with symptoms of ADHD start with an omega-3 supplement daily for 12 weeks and see if that helps. If your child won't take pills, and as you probably know, fish oil capsules can be really big, but there are thankfully 2 liquid options. One's from Nordic Naturals, like a lemon-flavored liquid, so you can mix it easily into a smoothie. I've put it on my kids' bagels under their cream cheese, put it in their orange juice. You can find ways to hide it, and honestly, even neat, it's not that bad in my opinion, but kids might have a different opinion. And then there's a different one called Barlean's that's like this fruity emulsified. It's almost like a Danimal yogurt. Personally, for me, it's very strong. It's a very sweet, it's sweetened with sugar alcohol, so it's a really sweet, strong flavor. But my kids do like that too. So that's another one that can be well tolerated by children. Micronutrient supplementation is something I find really interesting. And there's a doctor named Julia Ruckledge. She's written a book about this. She's done studies in ADHD. You can find more information about that on my website. But basically, it might be in part from zinc and iron supplementation, which have recently been shown to possibly impact dopamine signaling and be helpful for kids with ADHD. But other things in the micronutrients may also be part of it. In addition to prescription medications, non-prescription supplements, we can also consider things like neuromodulatory therapy. So there's actually transcranial magnetic stimulation devices that are available. There is biofeedback, which is when kids sit with a device on their head that monitors their brainwaves, gives them an EEG, and they have sort of a visual pattern to try to better be able to control their focus and attention. I don't think there's really great evidence that this then translates into their ability to do that when they're not hooked up to the biofeedback device, but it is something that many people do seek. The people who are proponents of it swear that it works. I have kind of a biased view of it probably because I've never really seen a kid for whom that was super successful. But again, I probably see the people for whom that wasn't successful, and then they come to see the child psychiatrist for medication. So it might be a bias in my sample selection. And recently there was approval by the Food and Drug Administration for a video game. It's called Endeavor RX that has evidence for being helpful to improve kids' focus and attention. It's tested on kids between ages of 8 and 12. And I know lots of kids during that age range really like video games. So that might be another way to supplement the other things that you're doing for your child with ADHD. All right. So I just want to kind of review using Oprah's questions. My intention for this podcast was to give you all kind of an overview of what is ADHD. Is it a real diagnosis? How do we assess it? What tools can you use today that are free to kind of screen your child if you're worried about it? Where can you go to get good information about medication treatments? What are the side effects? All of that kind of stuff. Like just a big kind of 30,000-foot overview of ADHD and to give you some resources. And just a reminder, I put resources in the description of the show. So if you want to know about that YouTuber, if you want to know books that I recommend, if you want to know supplements, that's all going to be in the description. Then what is important is understanding that ADHD is very common, that it doesn't have to mean that your child is going to do poorly socially or academically. And I think it's really so important as parents that even if you have a child who does meet criteria for ADHD, don't let that label make you or your child feel that they are in any way defective or that they should be ashamed. Kids come in all shapes and flavors and types. And you know what? All of us have different strengths and different weaknesses. And there are many super successful people in this world who met criteria for ADHD in childhood and probably still do in adulthood. It doesn't mean that your child can't achieve whatever they want to achieve. And it's very important, I think, also to remember that grades do not indicate intelligence. And although school tends to be pretty rigid and tends to have certain expectations that are very hard for some kids to achieve and to, meet, that doesn't mean that your kid won't be successful once they're in a more flexible environment that they can control, which is definitely going to happen once they become an adult. So be your child's best advocate, love them, just believe in them, and work with your school setting. And if you can't, have an open mind. There are so many other ways that you can educate your child now. There are so many online schools, community homeschooling programs, like so many options, more than at any other time, I think. When I was growing up, if a kid was homeschooled, they were viewed as very strange and weird. Now, I feel like so many kids are homeschooled and it's really like a trendy thing to do. We're realizing that our modern school system was really developed from the industrial age, and we don't live in an industrial age anymore. we can teach our kids the things that they need to learn in a much more flexible kind of environment. So if your kid is really struggling in the traditional school setting because of symptoms of ADHD, I'm not saying don't educate your child. Don't get me wrong. Education is important, but I think we have to realize that there's many ways that one can learn. And just as it's hard for a kid with ADHD who's 6 years old to sit in a classroom for 8 hours a day, I mean, that would be like trying to get me to sprint. Like my body is just not made to sprint. I can run distances, but I cannot go fast. So if your kid is just not built for that, that's not their fault. It's just who they are, and that's okay. So that's what I want to leave you with. And then also the information that I think is really important to recognize that in my experience, treating young kids, especially with prescription medications, doesn't seem to be something that they really love, even if it leads to positive changes from the parent's point of view and from the teacher's point of view about the rating scales. Like they're performing better at school, they're turning in their homework and all of that, but it doesn't seem to translate into the kid is happier. I'm just leaving that as a grain of salt, okay? Like it's something to think about, a little seed that I'm planting. I could be wrong. Please email me if you're like, no, my kid loves their medication. I would love to be proven wrong. I would love to know that some kids really do like their medications, but older adults and older teens love ADHD medications when we find the right one. I don't know what it is about young kids who just don't seem sold on it. And I don't really know what to make of that. But as a psychiatrist and as a mom, I would feel better about the frequency with which we treat our kids with stimulant medications if it was leading to a positive outcome that felt good to the children as well. And that doesn't seem to be true in my clinical experience. All right, guys. So next time we're going to be talking about trauma in episode 8. So please stay tuned next Friday to join me for that one. And if you are interested, every third Wednesday of every month, I have a free book club. You can find that link in the show notes. Also in my link in bio on my socials, also on my website. That is free. Anyone can join it. If you're not yet on my newsletter list, please sign up for that as well, which you can do in the link in the show notes or on my website. Take care. Talk to you soon. Bye.